This presentation gives an overview of where we are in Wales in relation to implementing the new Nursing and Midwifery Council standards for education and training. You're very welcome. Thank you for tuning in. The presentation is in 4 sections. So as you'll see as I go through the presentation, it's possible for you to click onto any part of the presentation that you would want to look at and fast forward to any particular slides for clarification. My name's Simon Cassidy and I'm Programme Manager Education Wales, and I work within Health Education and Improvement Wales. And my role is to lead on the implementation of the new NMC standards across Wales, linking with the universities and with the health boards. Of course, we've had the publication of the Nursing and Midwifery Council standards since May 2018. We've had the standards for education and training, which are in 3 parts. Part 1 relates to the standards framework, the policies and procedures that need to be in place to underpin the quality assurance of the new programmes. The standards for student supervision and assessment, which herald a new era of mentorship. And programme standards, which refer to the curriculum content and the new practice assessment document included in those particular elements of part 3 of the standards. And then we have the standards of proficiency. So far we've had the nursing pre-registration proficiency standards published. We've had the standards for post-registration prescribing, and we've had the midwifery standards approved here. We've had the expectations and requirements for return to practice nursing, and we are yet to await the wider consultation that the NMC is undertaking in relation to the specialist community public health nursing programmes and specialist practitioner qualification. I hope that as a result of the presentation I can satisfy these 2 questions, at least to some degree. What's different about the new NMC standards for education, and how will this affect my role in supporting students? What I would urge you to do, though, is also to tap into the local preparation sessions that have started to be offered in order to look at the various elements of the Common Wales documents and the local arrangements for implementation of the NMC standards in much more detail. However, this presentation will hopefully signpost you to where we are currently in relation to implementation of the standards in Wales. What I'd like to do in order to satisfy those 2 questions is to give an outline of the changing landscape of pre-registration nursing education, both in the UK and in Wales. I'll mention some key drivers for change, both locally in Wales, underpinning the new Nursing and Midwifery Council, raising of ambition of what's expected of a new registrant. And then I will talk about some of the common documentation that's been developed over the last year as a result of co-production with various key stakeholder groups. But I'll focus in particular on the new era of mentorship, the standards for student supervision and assessment, and the new roles of practice supervisor, practice assessor and academic assessor, and how they will operate. And I'll walk you through the new practice assessment document that we've devised for Wales, which benchmarks against the new proficiency expectations. So let's start with the changing landscape, and then we'll look at some common All Wales elements. Then we'll focus on supervision and assessment, and then I'll give an indication of where we move to going forward. All of the documents that I refer to today will be found on Health Education and Improvement Wales web pages, and here's the link for those, so tap into that. We will expand the pages to include a range of other learning materials, frequently asked questions, and some other elements that underpin the new nursing and midwifery standards. Let's look at a changing landscape. We've had various iterations of nurse education over the last 20-30 years, from the traditional style, the apprenticeship style of training in the 1980s, and the moves towards University-based education in the 90s with Project 2000 and underpinning evidence base for nursing practice and the professionalisation of nursing were key drivers at that point, and we've had further evolution of nurse education through Fitness to Practice, Nursing 2012, and our current programmes are titled Once for Wales 2020. 6 universities in Wales currently offer nurse education programmes. However, it's an interesting time in Wales in relation to nurse education provision. There is a tendering process that will be undertaken over the next couple of years, and it's potentially possible that we may have some new providers who may be able to offer that opportunity for those individuals who otherwise may not see themselves registered as a nurse. There are a number of key policy drivers that underpin the new proficiencies within Wales. This list isn't exhaustive, but of course we should highlight on a healthier Wales the moves from secondary to primary care and the importance of ensuring a collaborative, integrated health and social care system. Much more emphasis in the future on digital literacy within programmes in Wales, and of course the importance of prudent healthcare. Much more of an increased focus on public health, preventing ill health, supporting health and lifestyle choices. A readiness to deliver future care at home, or certainly closer to people's home settings. A focus on integrated health and social care as being such vital importance in delivering high quality healthcare services. And much more emphasis on leadership within the new programmes, and registrants having transferable skills. The Nursing and Midwifery Council have published 2 annexes which detail some enhanced skills and nursing procedures which will be required of students to safely and effectively demonstrate. Some examples: monitoring of blood glucose, insertion of catheters, undertaking venipuncture and cannulation. Some examples that students will be expected to safely and effectively demonstrate by the end of the programme. You might say there's a difference between an intuitive expert practitioner who's able to undertake those skills and nursing procedures as a result of the regularity of their practice. So at the point of registration, of course, students will need to meet the proficiency requirements to safely and effectively demonstrate those enhanced skills and procedures. But when employed in a particular context of practice, they will also need to undertake an induction and further enhancement of those skills as required by the context of their employment. We need to ensure that by those individuals embarking on nursing programmes, that by the point of registration, they're in a position to build on their personal and professional development with the ambition of working at the top of their licence of the nursing profession. We need to collaborate to ensure that we're providing high quality undergraduate nursing education. We need to ensure that the new programmes are able to meet the requirements that the Nursing and Midwifery Council have. And we need to attract and retain students when graduates to replenish the workforce in Wales. Interesting to look at our student commissioning numbers, and you can see the blue bars refer to the student commissioning numbers from 1998 to 2016. The red bars refer to the increased numbers over the last couple of years, and those students who started in 2017 will be the first students, assuming they have taken advantage of the bursary arrangements, the first students to pay back 2 years in Wales healthcare services. You can see the adult student numbers and how that's increased in recent years, but that figure of student population, actually those commissioning numbers have increased across all of the fields of practice, and particularly the grey line for mental health student commissions reflects the better recognition of mental health within the general population. So we've looked at the context for nurse education. Let's look in a bit more detail at the All Wales common elements in meeting the NMC standards for education. Our new standards, of course, meet the requirements for the standards of proficiency and the standards for education and training. Between January and April in 2019, we held a series of regional workshops across Wales where we looked in detail at some of the early drafts of documents that have since evolved into final document agreements. The second phase was more about presentation of the documents that we've agreed across Wales. There are a number of sensitivities within the workshops that arose as a point of discussion. One of the issues related to field identity, that when we have a common set of proficiencies, students will still need to benchmark achievement of those proficiencies against the field of practice that they've entered. So their placement journey, their understanding of those issues that relate to the specialism of the field that they've embarked on will still be evident within the new programmes. But one of the underpinning principles of the new programmes is that all students need to understand the needs of all people who come into their care across the lifespan. So it's important that adult students have an insight and understanding of the fundamental care needs of people with mental health issues, with people with learning disabilities, that reflects the way that services are developing. And equally, that students who've embarked on a mental health or learning disability programme understand the complex physical health needs of those individuals, that you're a person first and that you experience needs. And the way that services have been redesigned, actually those individuals are accessing generic services far more than they may have done 20 or 30 years ago. So the underpinning philosophy and the importance of all students understanding the needs of all people who come into their care is a key tenet of the new programmes. Likewise, we had a number of discussions about the transition from one system of mentorship to the new standards for supervision and assessment, and the new roles of practice supervisor and practice assessor and academic assessor. Looking at the common elements across Wales, we have a number of key documents that have had the benefit of co-production by those individuals who've attended workshops, and they've included, importantly, service users and carers, students and practitioners from across all fields of practice, including pre- and post-registration programme support, as well as university representatives also in those workshop events. So we've devised and evolved a number of key documents for use across Wales that have been agreed by the All Wales Nursing and Midwifery Pre-Registration Group, who has oversight of the direction of programmes and the direction of the common elements that underpin those programmes across Wales. We have a document that outlines the values and attributes that we would expect of a student entering programmes across universities in Wales. The values and attributes that are contained within the Student Selection Recruitment Principles documents are what universities would benchmark their interview arrangements against. We have a document that gives an overview framework and guidance for practice supervisors and assessor roles and requirements. We've also devised a handbook that goes alongside that, so those individuals who come to preparation sessions would be signposted to the practice supervisor and assessor handbook, and I'll show you what's involved with that in due course. And of course, we've got our new practice assessment document that actually has this time around had a change of format. So the content mirrors the proficiencies that the NMC have published and is benchmarked against that and is mapped against all of those elements. But it also has a new format. All of the universities in Wales are moving towards an electronic practice assessment document, which will require further dissemination in relation to local arrangements. Across Wales, we've devised a practice assessment document guide, and when individuals come on the practice supervisor and assessor preparation programmes, they'll be signposted to that guide. So there's some screenshots and then explanations of how you complete the particular document in question. We've also devised an All Wales slide presentation. So the facilitators of the preparation sessions, not that they will be slaves to PowerPoint, but can use the PowerPoint slides to guide the discussions and to ensure that the key content is covered. We have a new revised educational audit document that has been streamlined from the current version and meets the new requirements in relation to student supervision and assessment and the quality of placement offerings. We've also got a student evaluation document. That document students complete post-placement, and each university alongside its practice partners will ensure they have appropriate mechanisms to ensure they have that feedback back to practice on the evaluation of placements. Okay, this next section focuses on the new standards for student supervision and assessment. It's interesting to think about where we are in relation to the history of mentorship and the rationale for the changes to the new standards for student supervision and assessment. We know from the mentorship literature over the last 2 decades that emotional burden that potentially individuals feel because of the dual conflict between nurturing, supporting and also assessment can cause some individuals not to address concerns. And that's where we start to enter the territory of giving students the benefit of the doubt, of failing to fail. So the new standards address that potential conflict, and over the next year we in Wales need to benchmark current workforce of mentors and sign-off mentors and practice teachers and registrants to benchmark against the new roles: practice supervisor, practice assessor and academic assessor. Practice supervisors will be health and social care registrants. That includes all nurses, but potentially other allied health professionals as registrants supporting pre-registration student nurses. Practice assessors are within a placement or a series of placements, and those individuals will be required to periodically observe the student's practice and to collaborate closely with the practice supervisors in order to assess the feedback that comes as a result of practice supervisors' formative work with students. So that connection between practice supervisors as being all registrants and that connection with practice assessors, who will be ultimately responsible for the accountability of assessment decisions on students' proficiency, will be key to the credibility and the trustworthiness of information about students' achievement and proficiency. Also, in terms of the literature of mentorship, we know that the connection between the practice assessor and the university and the academic assessor needs to be close in order to substantiate the student's movement from one part of the programme to the next, and that the voice of practice through this mechanism, this tripartite mechanism, supports the gatekeeping responsibility is everybody's business. Nursing and Midwifery Council standards for supervision and assessment apply to all programmes, including nursing, midwifery, non-medical prescribing and the new specialist community public health nursing and specialist practitioner qualification, as well as return to practice. And I've mentioned earlier about the transitioning of student supervision and assessment arrangements. So for those mentors and sign-off mentors and practice teachers to become familiar with the new practice assessment document and local arrangements of the new implementation of the standards, for those individuals they will undertake a minimum half-day update session. For those nurses who are not currently mentors, sign-off mentors, then they will undertake a full-day practice supervisor preparation session, and these are minimum timeframes. We also need to develop new practice assessor preparation programs, particularly for those students who register in the future in 2023, who will already register having met the practice supervisor requirements at the point of registration. But also when we're thinking about expanding placement capacity, we also need to think about generating new practice assessor programs for areas that may not currently have mentors or sign-off mentors. So for the new practice assessor program, that will be a minimum of 2 days. That said, we have a range of blended learning resources available. It would be expected that individuals undertaking the new preparation programs would take advantage of additional supportive information that they would need to achieve given their individual tailored requirements. We've developed a couple of forms within the overview framework that outline a benchmarking of current mentor, sign-off mentor, practice teacher against the new practice supervisor role. We also have a PADR revalidation insert. This enables individuals to collate their ongoing practice supervisor and assessor activity and use that for discussion within annual personal appraisal and also at the 3-year revalidation point. It's clear that in terms of models of supervision and assessment, one size may not fit all, and workshop discussions have welcomed new arrangements across Wales in relation to the potential for new models of supervision and assessment. We've produced a number of diagrams that reflect potential new models, and it's especially important to look at new models and the way that they're applied to a practice, particularly when it comes to considering increases in placement capacity. So the diagram on the slide, it relates to a team model. That may be a ward, it may be a community team, and you would have your nominated practice assessor within that team. You would also work with other registrants who would be practice supervisors. However, what we also want to ensure is that students experience a continuity of experience as a student. So we don't want to disrupt that, and one of the recommendations for us in Wales is that within placements, when individuals are considering organising their practice learning environments, that they identify designated practice supervisors. They would be individuals who be identified for the students, who the students could relate to during the placement experience. So they're people who can support the continuity of their experience within the placement setting. We also need to devise new types of placement. And one idea that's already been looked at in terms of new placement capacity is in looking at a rotation model. So in the example on the screen, what those 3 circles would indicate traditionally would have been 3 spoke areas, short placements, but now have combined together to form one legitimate placement that actually follows the patient's journey. The new supervision and assessment arrangements allow for a long arm model, so this model may reflect a GP practice nurse who is the only person as the nurse in that surgery. So that individual would act as the student's practice supervisor, and they would have a reciprocal arrangement with a GP partner practice to supply their practice assessor. So what's key going forward is to look at different models of supervision and assessment, particularly with the need to generate new placement capacity, and there's a welcome for the new Nursing and Midwifery Council standards in relation to modelling of supervision and assessment in more flexible ways. In Wales, we've also devised a number of storylines. These are storylines where individuals can envisage how the new supervision and assessments arrangements might look in particular practice settings. So this example is of a urology ward. You can see the diagram. So when you read the story, the envisaging of the new model of supervision and assessment is brought to life. This third piece of the jigsaw in the presentation refers to the new All Wales practice assessment document for pre-registration nursing. The document mirrors the standards of proficiency that are expected at the point of registration, and the new document has been mapped against each of those proficiencies and annex requirements. The document itself is structured alongside the 7 platforms that the Nursing and Midwifery Council have published. You would need to be able to meet the proficiency to be an accountable professional, to promote health and prevent ill health, to assess needs and plan care, to provide and evaluate care, to lead and manage nursing care and work in teams, and to improve the safety and the quality of care, and to coordinate care. And the 2 annexes are being mapped also within those proficiency platforms. So the structure of our document, you will see the 7 platforms in each part of the programme, and underneath each of the 7 platforms there are relevant learning outcomes for students who may be on part 1, part 2 or part 3 of the programme. This is the front page of our new practice assessment document and indicates the co-production process and the buy-in across all of the universities in Wales for a common practice assessment document. I've produced a number of screenshots to illustrate what's contained within the document, but when you read the document in full, you will see a narrative which precedes each one of the screenshots. We have a new orientation to the practice learning environment. This document is to be completed within the first week of each practice learning experience and includes a general orientation to the environment, but also indicates areas such as, does the student understand how to raise concerns? And in the workshops we had a number of discussions about the current format of the professional attitude score, which contains a series of Likert scale statements which the student needs to score 3 and above in each of the statements to pass. One of the concerns within the workshop were that participants felt that there was an element of subjectivity involved in the current version of the professional attitude scale, that if a student scores a 3, then why don't they score a 4, 5 or a 6, for instance? And the consensus view was that we should move to a professional attitudes and behaviours assessment that includes statements which students demonstrate. Practice supervisors contribute to this document and would conduct a midway review and would also give a view and a perspective on the student's achievement and the proficiency statements contained within the professional attitudes and behaviour assessment. But it's the nominated practice assessor who ultimately would confirm the student's achievement, and the student would also confirm that they've agreed that. As at the moment, the professional attitudes and behaviours assessment is completed twice within each allocated practice learning experience, once at the midway review and once at the end. And there's space on the form for written documentation from practice supervisors and assessors also. The student learning contract is similar to what we have at the moment. There's an initial statement of intent discussion and documentation between the student and the practice supervisor. There's a midway review conducted by the practice supervisor who will complete that midway review, and then there's a statement of achievement where the practice assessor looks at the feedback and the periodic observations of the student during that practice learning experience and will document that particular section. There's also space within the document to comment on the student's attendance, including the numbers of potential sickness days that the students experienced, or authorised absence or unauthorised absence, and that record is transferred to the university to ensure that the student completes 2,300 hours of practice by the end of the programme. We have an additional practice learning record that's to be completed for any additional student experiences that the student has of 1 week or less. The person responsible for supervising the student within those environments would complete the additional practice learning record, and the student would take that back to their practice supervisor and practice assessor to contribute to their achievement of ongoing proficiencies. We have a new service user and carer feedback form that replaces the current smiley face version. The new form has benefited from a number of consultations with service user and carer groups across Wales. The rules of completion have changed also, so during each part of the programme the student should aim to complete it, and it should be the practice supervisor or assessor who approaches the service user carer in order for them to complete the document, not the student. And the practice supervisor and assessor is in a better position perhaps to assess the reasonable adjustments that may need to be required for somebody to be completing the form. Consideration of advocacy, for instance, if the form was to be completed by a person with learning disabilities. Also to consider that it may not always be feasible for an individual to complete the form if they are in distress or pain. And the practice supervisor and the practice assessor would collect the feedback from the service user and carer and be able to feed that back to the student at some relevant point, maybe at the midway point in the learning contract, so that the student has that feedback and is able to reflect on that also. This is one of the versions of the form, but when we consulted with children and young people, whilst they like the streamlined language and they like the photographic reference points, they didn't actually identify with the characters involved. So we have another version which could potentially be offered to children or young people, or in fact adults for that matter. So it doesn't matter which form you use, and there is a second part of the form which enables people to write in. Whichever people feel most comfortable with, that's absolutely fine. We have assessment criteria for each stage of the programme as well. So in part 1, which in a 3-year programme will be year 1, we're expecting that students undertake proficiency with guided participation in care. In part 2, more active participation with more minimal guidance. And in the third part of the programme, in the 3-year programme, that would be year 3, we're expecting students to demonstrate more leadership skills and be able to coordinate and manage care. This slide indicates another change to the new practice assessment document from what we have at the moment, in that this replaces the shaded box system. I mentioned earlier about the document being structured underneath each of the 7 platforms. So you can see this example from platform 1 being an accountable professional, and underneath platform 1 in the proficiency numbers 1 to 5 we have the relevant learning outcomes for a student who's in part 1 of the programme. You can see the reference to what the pitch of the assessment would be expecting, the assessment criteria, which is that students need to perform proficiency with guided participation in care. One of the underpinning principles of the new document is that any signature that would be entered to indicate that the students achieved the level of proficiency that's required for each of the proficiency learning outcomes would only be as a result of the students' engagement in a range of activities of healthcare, not a one-off activity. So the underpinning principle for achievement of learning statements and learning outcomes is that the student has engaged in a range of activities, not simply a one-off event. Students must complete all Part 1 requirements by the end of Part 1. So for a 3-year programme, that would refer to all of the elements that are required for year 1. It may be that a student does some work towards achievement of particular proficiencies, but not enough for the practice assessor to feel comfortable about signing that student off on a particular specific proficiency, in which case the practice supervisor would sign in the working towards column. If the practice assessor feels that the student has achieved a learning outcome, they would sign in the achieved column, and the student would confirm that in the students achieved column. You'll see a number of brackets on the slide. That indicates where the annexes A and B have been mapped within the proficiency headings. Others, as I'll show you, have been mapped in a separate inventory, which I'll come to in due course. This is the form that the practice supervisor and the student would complete to indicate working towards. So the student would provide evidence of achievement of particular proficiency outcomes. The practice supervisor would enter comments on the student's progress towards achievement, and that would act as feed forward when the student takes that information to the next placement. And on that next placement, the student would be able to discuss what they'd achieved in the previous practice learning setting. Those outcomes could be looked at in terms of tailoring student experiences in the subsequent placement. So over the course of the programme, of the part of the programme, students would use this feed forward mechanism to build and scaffold their learning opportunities. Here's an example from year 2 or part 2 of the programme. So here we're expecting the students to be more actively participants in care, and all year 2, part 2 elements of the programme in the practice assessment document must be completed by the end of that part to substantiate the students' move to the next part of the programme. Practice supervisors would indicate working towards when that's appropriate, and the practice assessor would confirm achievement whereas students achieved particular learning outcomes. And then the subsequent form, which is replicated after each one of the platform headings, within each part of the programme. So the student would indicate evidence of additional practice learning experiences where they felt they've done work towards achievement of particular outcomes, and the practice supervisor would enter comments which would act as feed forward when the student progresses to the next placement. Here's an example from Year 3, Part 3 of the programme, where we're expecting students to be demonstrating proficiency by leading and coordinating care. Again, achievement as a result of students' engagement in a range of activities, not a one-off event. Practice supervisors to confirm working towards where appropriate, and practice assessor confirmation of achievement. And the subsequent page where students would indicate where they feel they've done work towards achievement of particular learning outcomes, and the practice supervisors will enter in to indicate working towards progress towards achievement, which acts as feed forward. In addition to the continuous assessment process, we also have 4 one-off in-point assessments dotted through the 3 parts of the programme. 1 in the first year or first part, 1 in the second part of the programme, and 2 in the third part of the programme. The date and duration of the in-point assessment must be agreed in advance, so it shouldn't be a surprise to a student when they undertake their in-point assessment. They would have done formative work with their practice supervisors in readiness. The nominated practice assessor must undertake all of the in-point assessments. And a student will be given 2 opportunities to achieve, so they must achieve all of the elements in the in-point assessment as identified in order to achieve that in-point assessment. If they are unable to meet all of the elements in the in-point assessment criteria, a second opportunity will be discussed, and that discussion is important, and it must include the practice assessor, the academic assessor, the practice supervisors involved, and the student themselves. If a student doesn't achieve a large proportion of the elements of the in-point assessment, then that will trigger a discussion about an action plan. The action plan will include specific additional learning outcomes that will be tailored for the student in order to retrieve the elements that they haven't actually met within the assessment criteria. However, should a student not achieve at a second opportunity, then that would be entered to each of the local university exam boards, and there would be consideration of a further attempt. Here you can see the first in-point assessment, which must be undertaken. It involves a student's engagement in an episode of care, which must be specific to the field of practice that the students embarked on, whether adult, learning disability, mental health, or children's nursing. The practice assessor would sign in the column to indicate achievement of all of the elements, if that was the case, in which case the student would have achieved that in-point assessment at that stage. Or if the student hasn't achieved all of the elements indicated in the in-point assessment, then the practice assessor would sign in the column to indicate working towards, and that's where a second opportunity would be reviewed and discussed. The practice assessor would enter comments on the subsequent page, and the academic assessor also, and the student would be required to reflect on that in-point assessment and discuss this with their practice assessor. This is the in-point assessment that occurs in Part 2 of the programme and relates to medicines management. If the student achieves all of the elements of the in-point assessment, the practice assessor would sign in the achieved column. If, however, the student does not achieve all of the elements indicated, the practice assessor would sign in the working towards column, and that's where a second opportunity would be discussed. And should the student not have achieved a substantial proportion of these elements, there would be consideration of a more detailed action plan where that's required. And again, the student would complete their reflection, and the practice assessor would also add on the subsequent pages after the in-point assessment to indicate the achievement. Here we have the first of the 2 in-point assessments that occur in the final part of the programme. And the first in-point assessment refers to a student's ability to meet the requirements to become a practice supervisor. All of these elements, the students would be required to teach others. That may be other students, it may be their peer group, it may be other staff groups, it could be service users and carers also, and that would be determined by the practice assessor discussions in the setting up of the endpoint assessment. Again, the practice assessor would sign it to indicate achieved if the students achieved all of the elements of the endpoint assessment, or working towards where that's relevant, and if that was the case, a second opportunity would be discussed. And the student completes the reflection and discusses this with their practice assessor. And the final endpoint assessment refers to leading and managing and coordinating care, and this assessment must be undertaken in the final placement, the final period of practice. The practice assessor indicates working towards or achieved as appropriate, and indicates further comments as appropriate, and the student completes a piece of reflection on that endpoint assessment of them managing, coordinating and leading care. I mentioned earlier that the majority of the annexes have been mapped within the platform Proficiency headings within each part of the programme, but we also have a nursing procedures inventory which, wherever practicable, will be undertaken in practice, but could potentially be undertaken in simulation either in practice or within an academic setting. We have a form attached to the inventory where a relevant supervisor with particular expertise in undertaking that nursing procedure would complete the form, and the practice assessor would sign to confirm that they have reviewed the evidence of achievement of a student safely and effectively demonstrating that particular nursing procedure. At the end of each part of the programme we have a summary document, and the practice assessor and the academic assessor would confirm that students have achieved all of the relevant elements in order to progress from one part of the programme to the next. And this form occurs at the end of part 1, the end of part 2, and on entry to the register. We also have an action planning protocol embedded now within the practice assessment document. The action planning protocol is in 3 parts. This is the first part, part A, and it includes a number of evidence-based questions that those key stakeholders involved with a student who was not meeting the required levels of proficiency would ask themselves to indicate the transparency, the fairness of the process of assessment. So the action planning protocol only comes into force when a student may not be meeting the required levels of proficiency. Part B of the action plan protocol actually involves a template which encourages those people who are involved with the student, including the student themselves, to write some smart objectives of what exactly those concerns relate to. So those objectives can be used for the formative development of the student and for the student to have a fair and transparent opportunity to retrieve. The final piece of the jigsaw relates to the future direction following implementation of the new proficiencies and supervision assessment arrangements. The NMC will take a different approach to monitoring. Rather than regular scheduled monitoring visits, they will undertake a more risk-based approach to monitoring in the future. We would hope to evaluate the effectiveness of the new programmes in Wales, and already there are moves to ensure that we are collecting the appropriate data to enable that programme evaluation to take effect. And we've developed a number of exemplars, the storylines that I talked about earlier, and we will continue to add to a Wales resource library that will be available on the web pages within Health and Education and Improvement Wales site. So I hope I've gone some way to satisfy those 2 questions in the presentation. What is different about the new standards for education, and how will this affect my role supporting students? We've looked at a changing landscape, we've looked at common All Wales elements, and we've focused on supervision and assessment, and we've looked at the future direction and where there will be new expectations. There is a raising of ambition for future registrants to meet the anticipated changes of the healthcare needs of the population from 2030 and beyond. But some things will endure in nurse education. Person-centred, compassionate care is as relevant as it was 100 years ago, now and in the future. And person-centred, compassionate care is embedded within the new programme, curricular content and the new programme proficiencies. Thank you for listening to the presentation. My contact details are available, so you can contact me if you want to email me for any further advice. And as I said at the beginning, tap into the presentation sections as you see fit and fast forward to the sections that you want to be further clarified. Thank you.